Hello, good morning. Today we are going to discuss the soft tissue injury and its management. What is soft tissue injury? Clinically, whenever the patient will come trauma and fall injury, there will be presence of three clinical presentation, which are contusion, abrasion, and laceration. Yeah, in abrasion, there is only the destruction of the superficial layer of the skin or epidermis we can see, because there is only a lightweight or light frictional force which act on the surface of the skin like this. That's why it is the only there will be the destruction of the superficial layer of the skin. In that abrasion, the wound is bright red in color. We can see that is the bright red in color from the first 12 to 24 hours. It will be bright red in color. After that 2 to 3 days there will be change of the there is a formation of the scab. We can call it as the formation of scab after 2 to 3 days, and after 4 to 7 days the defected wound is healed from the periphery to central, and after that after 7 days the scab will dry up and fall off. Now after that the pigmentation of the wound takes place after 10 to 12 days. Now we will talk about the another clinical presentation, that is contusion. In contusion, there is a effusion of the blood into the tissues, that is called as the contusion. And how exactly the contusion appears from the abrasion and laceration. In contusion, there is no destruction of the skin or epidermis layer, because only the blood effusion will be present in that case. In contusion, there is a color changes of the wound from the injury to the healing period, because in contusion there is a lot of processes called red blood cells are converted into hemosiderin and bilirubin products. That's why there will be a changes of the color in the contusion. From few hours to 3 days it will be a bluish color because of the accumulation of the red blood cells, and 3 to 5 days or 3 to 6 days it will be appears as a brownish to blackish color because of the deposition of the hemosiderin and the pigments, and up to 5 to 7 days or 5 to 6 days it will appears as a greenish color because of the disintegration of the products to the hemosiderin or bilirubin, and from 7 to 8 days it appears as a yellow color because of the last product, which is the bilirubin, is present at the time of the healing period. Now we will talk about another clinical presentation, that is lacerated wound. In lacerated wound, there is a tear or split of the skin, mucous membrane, muscle and other internal structures. It is due to the application of the blunt force to the surface area or to the body. And in lacerated wound, the tissues are stretched or crushed beyond their elasticity. And other types of the wounds are slash wounds and penetrated wounds and perforated wounds like through and through wounds, and Rank and Wakefield classified wounds as tidy wounds and untidy wounds. The tidy wound is which contains there is no devitalized tissue, that is called as the tidy wounds, and untidy wounds that contains the devitalized tissue. Now coming to the management part of the soft tissue injury. In the management part, first we should stop the bleeding by the hemostatic agents like applying the pressure on the wound and by the gauze piece. And we can also use the local anesthetic agent also. After that bleeding stops, we will go to the cleaning of the wound by the normal saline. And antiseptics should not be used for the cleaning purposes. Antiseptics are used after the cleaning. The most commonly used antiseptics are povidone iodine 10% solution, and after that we will go for that toileting of the wound and the debridement of the wound by the sharp instruments like scissor. All the devitalized or necrotized tissue of the wound we should remove. And sometimes we can also use systematic hemostatic agents like tranexamic acid and vitamin K. But before that, we need blood investigation like CT, BT, and INR. And there is a contraindication of tranexamic acid in the patients like cardiac patients and patients who are on that ecospirin tablets. Before the use of the systematic hemostatic agent, we should know the patient condition and the medical history of the patient. And in the wound closure, basic principles of suturing should be met, and avoidance of the excessive tension and layer wise closure is required to prevent the dead space and fluid accumulation. And after that, broad spectrum antibiotics and tetanus injection given to the wound patient. Thank you.